show your face. Feel free to not show your face on the camera if you do not want to be recorded, but welcome and thank you for joining us tonight. My name is Erin Pollard. I'm the Executive Director here at DC Forensic Nurse Examiners. We're joined by several of our team and staff today, and we wanted to extend the opportunity for folks who were interested in becoming a forensic nurse to have access to people who are doing this work and share their experiences. Feel free to, openly ask questions. We're a very informal and casual bunch, and so we're open to sharing our experiences and, really letting folks know what it's like to work in this role that, not many people may have much knowledge about. So I'll turn it over to our clinical program director, Sarah.
Yeah, so let's go through, we'll just kind of introduce ourselves. My name's Sarah, I'm the Director of Clinical Programs. I've been with DCFNE for about 4 years now. The director role is something that's new for me. I still practice clinically as an FNE, both at the hospital and our clinic. And I've been a nurse for about 9 years now, 10 years. So Janessa, do you want to introduce yourself?
Sure. My name is Janessa Six, and I've been with DCFNE for about 5 or 6 years. And I work full-time as a forensic nurse examiner, as well as an advanced practitioner for DCFNE. And it's been a great experience so far. I will go ahead and pass it to Iris.
Hi, I'm Iris. I've been with DCFNE for almost 8 years, a couple months shy. And I've been a nurse for about 21 years. And I'm the clinical program manager, and I also do staff forensic nursing. And, oh, sorry, I'm gonna pass it to Melissa.
Hi, my name is Melissa. I've been a nurse for 4 years now. I've been with DCFNE for about going on 7 months. I work PRN, about 36 to 48 hours a month on call. And yeah, if you guys have any questions, we're here to answer them. And I'll pass it over to Roxana.
Good evening, everyone. My name is Roxana. I've been with DCFNE for over 1.5 years now. I mostly work weekend shifts, PRN, and I've been a nurse for about over 11 years now, mostly in community health. Glad to see everyone.
Thanks. So everyone who's not DCFNE, feel free to ask questions. We have much newer people here. We have people, our very experienced nurses, Janessa and Iris are here. So you can kind of get the perspective of, different types of employees at DCFNE.
Awesome. So I'll go ahead and start us out with some questions. First of all, I think it's good for us to kind of set a baseline and establish what a forensic nurse is. And I'm going to go ahead and have Janessa speak to what a forensic nurse is in the broader sense, as well as what we do at DCFNE.
Absolutely. So a forensic nurse is a registered nurse who has specialized training in forensics. We typically work with patients following sexual assault, domestic violence, or sometimes trauma. And we also can provide consultation and testimony in criminal proceedings or civil proceedings. And we also kind of work as in an integrated approach with the medical team to meet the holistic needs of the patient. So at DCFNE, we work at MedStar Washington Hospital Center, and we provide forensic services for all of the patients who present to MedStar, or all of the patients really in the DC area are often either transferred to MedStar or we meet them where they're at. So that's kind of a brief snapshot of forensic nursing, and anyone's welcome to add.
Yeah, I'll just add just a little bit. So that's definitely the type of forensic nurses that we are at DCFNE. And it's probably the most common type of forensic nursing. Forensic nursing basically just is describing anywhere where, nursing in the medical field interacts with the legal system. So there are other types, even nurses who work in the correctional system. They are considered forensic nurses. There are nurses that do death investigation, elder abuse investigation, or elder abuse exams. What are some other ones? I'm not thinking right now.
Legal nurse consultant,
Yeah.
asylum examinations for folks seeking asylum. So lots of different ways, and I feel like it's growing. It's a relatively young subspecialty. This year is actually the 30th year anniversary of the International Association of Forensic Nurses, and that kind of aligns with the birth of it as a subspecialty. So really young when you consider, all the variety of nursing specialties. One thing before we move on, I see we've got kind of a smaller audience, so I think we'd be remiss if we didn't kind of ask our audience members to, if you feel comfortable, to introduce yourself and maybe say why you were interested in coming today. I'm just going to call on folks, whoever's first on my screen. Cassie, are you able to come off mute and tell us about yourself and what brought you here to us?
Sure. My name is Cassie Kralovec. I have been a nurse for about 12 years. I actually worked at Washington Hospital Center in cardiology and then informatics. And for the past, 8 years, I have been a hospice nurse, inpatient, at different inpatient facilities in DC. But I have always had this interest in forensic nursing. I know a forensic nurse and a SANE nurse out in Colorado, and I've heard a lot from her about her job. And I don't know what draws me, but something draws me to this field. And I've been, had it in my heart for a while. So I've been taking care of little kids for the last 5, 6, 7 years, and I just feel like now my time is opening up, and I'm interested in learning more. So thank you.
Thanks for being here. I will call on Dr. T next.
Hello, everyone. My name is Trina Kirkland, and I have been a registered nurse for over 30 years, mostly in long-term care. I've did some ICU and stuff. Have a doctorate degree in healthcare systems leadership, so I'm all about change. And I've always been interested in forensics and things like that. So I just decided that I would join. I'm sorry, I'm still on my video, because I wanted to. I have the time now to do it, and I can focus on it, and I can be committed to it. So that's why I feel like now is a good time.
Excellent.
Thank you
so much. And let's see. Next, I will go to Tierra. If you're able.
Good evening, everyone. My name is Tierra Williams. I am a family nurse practitioner. I work at Children's National in the HIV Services Department. I've always really been interested in forensic nursing, and I am enrolled at Duquesne University's forensic nurse certification program. So I'll be starting this semester. So I thought that joining tonight would give me an opportunity to ask some of the questions that I may have.
Amazing, congratulations. And I'll call on Jen next. Jen, if you're speaking, you're on mute. I don't know, you might not be able to come off of mute, so I'll just give a pause. And I'll see, I know Monica said she was just getting home from work in the chat. So Monica, if you are available to come off mute and introduce yourself.
Hey, everybody. I'm sorry, I'm a little behind. It's nice to meet everybody. I think that's one of the main reasons I wanted to join tonight. I also work at Hospital Center. I'm a labor and delivery nurse. And so we see a few examples of kind of what you described earlier in terms of patients. And so that really sparked my interest because I think that's a level of nursing that I would actually be able to tap into with a little bit of my experience. I did ICU for 2 years and then have about a year of labor and delivery. And so I think it would be a nice mix to add forensic nursing to that. But mostly I'm just curious and interested in what forensic nursing looks like on like a day-to-day schedule type work. So I appreciate you guys having me, and I'm really interested to hear about what you guys do and what people like me who are interested in forensic nursing have questions about. So thanks for having me.
Thanks for being here. And this is an excellent segue into what is it like working for DCFNE? What's a typical day for a forensic nurse look like? And so, you know, I'll kind of open it up to any of the panelists who feel like they want to chime in on that rather than calling on you guys directly.
I'll go. So I will say that for me, I've almost been with DCFNE, like I said, almost 8 years. It's only been 6 months that I've been a clinical program manager, less maybe. So before I was full-time and, you know, at WHC. So for me, 36 hours of on-call was, you know, when I was a full-time forensic nurse. And I would mix that up however, you know, it worked for my schedule. When I first started with DCFNE, I had 2 smallish kids who are not so small anymore. And so for me, nights worked best and weekends. And a typical, you know, we'll say a typical day for me is, you know, if I'm on call like a 7A to 7P or a 24-hour call, you go in to the office for office hours, depending what day it is. You call patients, follow-up calls. You call their medications in for them. You find out how the patients are doing, if they want to continue their medication. Then you follow up with Alpha Pharmacy, which delivers, you know, their medication to them, STI, NPEP. So you do that for about an hour, depending on if it's a kit release day, Mondays and Thursdays. You are there to release the forensic kits or perks to the Metropolitan Police Department. Once you do that, you know, you're always on call. So if a call comes in, dispatch will call you, they'll tell you the patient's information. You typically wait a little bit to touch base with advocacy. And then you go see the patient. If they're in the emergency room, I would say maybe 75, 80% of our patients, probably maybe more, come in through the ED at the hospital center. There are times when we do have to go to other places in DC, other hospitals, if the patient is admitted to these hospitals, or if they can transfer to us. We would prefer that just for ease of care for the patient. Medications, some of our hospitals do not carry the medications that we prescribe, but we can go to them as well. And then, you know, we touch base with the patient, we touch base with the medical staff, we perform the exam, you know, patient is discharged, and then, you know, we continue charting. We all know nursing is all about charting. So you probably have a good 1 to 2 hours after you meet with the patient and you do the exam. And then you're on to, you know, just kind of a wait and see. For me, I live very far away. So if I'm at the hospitals, then I stay at the hospital until my shift is over. And you can do whatever you want to do, catch up on whatever you do. And then, you know, your shift is over, and sometimes I have no patients. Sometimes I can have 4 exams. The most I've done is probably 10 calls with maybe about 6 to 7 exams in a 24-hour period, which is a lot and it's exhausting, but that's what you're in there for. So I don't know if anybody else wants to chime in, but that's my typical day.
I can add. So I am a PRN nurse who mostly works weekends, day shifts, and evening overnight shifts. So I find that the weekend shifts can be fairly busy. A lot of action tends to happen over or activity, I guess I should say, tends to happen over the weekend. And for me, I got into forensic nursing mostly because on my other full-time job, I transitioned into more of a supervisory and administrative role, and I was really missing the patient experience. And I think one of the reasons I think in this role that I value most is the time that I get to spend with the patients, and it's very valuable. And so for me, a typical shift can start either at 7 a.m., but we can be called as early as 6 a.m. if your shift starts at 7. And so I tend to already have everything prepared. I have learned that you are able to maintain, a regular routine if you prepare ahead of time. So making sure that you have meals packed or a book bag, with snacks and ready to go on the fly. And I do go about my day during the weekends, just making sure that I am within a radius so that I'm able to report to the hospital within an hour time of getting called from dispatch. So typically for me early on, I will say as a new forensic nurse, the exams took a lot longer because you're a little bit more focused on making sure that all your T's are crossed and your I's are dotted. You're also trying to be very thorough in your documentation and your assessment, and you're getting you're getting acquainted into the role and everything that entails, which is really making sure that you're the liaison between the patient and the medical team and the emergency room, and also, keeping in touch with the advocate who's there for supportive services as well. And so I would say early on, my exams could be up to even 5 to 6 hours, on any given day. Now, a year and a half in, I would say on an average, 3 to 4 hours maybe. And so, and I'm feeling pretty good about that. But it does take, a lot of practice and dedication in making sure that you kind of get a routine down and how you want to both present the exam and then perform the exam. As I think many of the nurses here can attest, finding a routine and being consistent in how you perform your exam is key to kind of like finding your own I don't know how to say it, I'm missing the word, but just your routine, I guess.
Thanks, Roxana. Would anyone like to chime in about, what the exam, what might be offered in an exam? Maybe Melissa, because you haven't spoken yet. Just what, what might be in a forensic exam for our survivors?
Yeah, so when a survivor comes in for their exam, first it just kind of depends the time frame that they come in. 120 hours, which is 5 days out, that's the max. It's essentially for a perk, for a collection kit. If they come within 24 hours, you can offer them swabs. We can do the oral swabs, and basically swabs of any part of the body that was touched during the assault, and also document injuries, photography. But we also explain to them that we can offer all this much, but it's up to their choice as to how little or how much they want. So I always really explain to them kind of what their time frame is and what we can do and what they would like. And I tell them at any point we can offer medications if that's what they want. We can do a physical exam. I explain what it entails, a pelvic exam if they were sexually assaulted. And if they don't want that, then we can just do a visual just to see if there's any injuries, also photography. And I explain to them, we can do as little or as much as you want. I can photograph injuries, nothing, all depend to them. So basically they're in control of the exam. And really honing down on medications. We do offer STI preventative medications as well as Plan B, and if they qualify for it, and PEP. And there's certain criteria that come along with that as well. And in addition to that, we work really closely with the doctors too. So sometimes we see the patients before the doctors see them, and they really listen to our recommendations too as to what happened, as to what would be best for them.
Awesome. Thank you so much. I don't want to move over if anybody else on staff wants to chime in, or if the audience has questions, feel free to come off mute and ask. And while we are in this little transition, I know Roxana started with this, so it's a good segue to say, what made you choose to become a forensic nurse? So we kind of got Roxana's piece, but would anyone else from staff like to chime in about why they did this work? I'm on staff, I can chime in. So one of the reasons that I began doing this work was, I was working in an emergency department that did not have a SANE program. And so I've done this work. I think everybody else gave their background, but I didn't necessarily share mine, that I've been a SANE for a little over 10 years. And the first half of my SANE career, I spent working in the Baltimore area before coming to work for DCFNE. So back in Baltimore, I worked in an emergency department that did not have a SANE program, but I was acutely familiar with SANE because I have a family member, a relative who has been in the victim services field and actually was highly involved in the DC victim services field. So I was acutely aware of this, and the opportunity came up to take a course, and I wanted to expand into that expanded nursing role. So that was 10 years ago, and here we are. So I find that it has been super rewarding. It's not always the most uplifting job, and like with any nursing job, you have your difficult days, but I do think that even after the most difficult of days, I keep doing this work. So that's actually should be the second part of the question, is what brought you into it, and then why do you keep doing it? And I keep doing it because my cup gets filled from being able to have that one-on-one patient interaction, being able to be there for somebody and give them empowerment back in whatever that looks like to them after a horrible event has happened. So like that, I find that to be very rewarding, and what helps sustain me through this over a decade SANE career. So would anyone else like to share either what brought you in or what keeps you here?
I'll go again. What brought me here? I've always wanted to do forensics. And I think for me, that long ago, forensics was so underground. Like you knew there was a program there, but you didn't know how to access that as a nurse. And I think I just worked myself to the point where I was like, okay, I'm ready and I have enough experience. And for some reason, I did labor and delivery first, and then I did Neurotrauma ICU at the hospital center. And it was one day that one of the nursing supervisors said, I have a SANE patient downstairs and we're waiting for the nurse. And I was like, wait a minute, you have a program? And she was like, yeah. And I was like, what? I had no clue. And one of my coworkers who had left the ICU and went to the EP lab, she put up a flyer, and that's how I knew about DCFNE, and I took their 40-hour didactic and started PRN, and that was it. So for me, that was it. What keeps me here is, I started off PRN. As soon as we could do it, I went full time, dropped the Neurotrauma ICU. And then I was just like, I've always resisted. I've always told Darren this and Sarah, I always resisted management. I just thought it wasn't for me. And I also, I could not do that 9 to 5 because, like I said, I had small kids, and I was solely responsible for getting them to and from because of my husband's hours. But what's kept me here is I think it's just this transition into something else. And while I'm still doing patient care, it really makes me happy to take care of other people, other nurses, and just be involved that way. So I think that was a nice thing about this, the whole process.
I see a hand raised for Monica.
So I'm sorry, I'm not too Zoom like trained, so I don't know if raising a hand is appropriate, but I wanted to comment because I had a very similar, like, happily surprised sentiment as the last speaker when I found out that SANE was offered through Hospital Center. I actually found it through your Instagram page. And then as I did more research, I was very happy to find out that it was actually within my own hospital system. So my question from there stems to be, how do SANE programs get established in hospitals, and how do they come from major cities, or does the hospital itself go and choose to have this type of program within their system? And then, if you guys don't mind, I do have a second question. And it would be that what does this, how do you do forensic nursing after you've established this training? And now that you have that under your belt, what does that pathway look like for you then as a career, like some of you have established? Thank you.
No problem. I can chime in with question number 1. And it varies per jurisdiction. And so that's one thing that that you'll see if you get into this field, is that it looks different depending on where you're practicing. And it's usually jurisdictionally driven, where the programs are, how many programs there are, et cetera. So, my background working in this field in Maryland is that every county in the state of Maryland will have one designated forensic hospital. And sometimes it's the same for kiddos and adults, but sometimes it's a designated pediatric SANE and a designated adult SANE. And so they'll kind of break it up by jurisdiction or by region. Now, Washington, D.C. is a lot smaller than, a whole state. And so, Washington, D.C.'s SANE program is largely governed by the SART, which is the Sexual Assault Response Team. And the SART is a collaboration of victim service providers from government agencies, as well as from nonprofit agencies like ours. So I think that one thing that's really important to note is that while we have a strong partnership with MedStar, and MedStar lends us space and hosts our program, we're a nonprofit entity that's separate from MedStar. And so we're not employees of theirs. And that's actually that's a model that I hadn't seen before coming to DCFNE. I'd say that it's on the rise as far as jurisdictions choosing to have a standalone nonprofit model. But, when I came here 5 years ago, this was, somewhat revolutionary. You'll see that in a lot of other jurisdictions, a hospital-based program is actually employees of that hospital that staff the program. I could go on a whole lecture of why one might be preferred or preferable to the other. I will say, in keeping it brief, that the beauty of us being not hospital employees means that we're able to strictly focus on our mission and we're able to do whatever we can, staff creatively to maintain 24/7 staffing, make sure our nurses have the best training and education, and we don't have to jump through red tape or any, hoops of a hospital system. Another thing that I'll just add is, as far as how is it, decided, I found that just, with my knowledge of like national standards, at least, in the United States, that SANE programs aren't money makers for a hospital. It's actually illegal to charge a patient for a SANE exam. It's illegal under the Violence Against Women Act. And so a lot of hospitals are shying away from things that won't directly make them money. So traditionally, for hospital-based programs that I've seen, it's been a program that, it's been a hospital that embraces that mission and doesn't care that it's not a moneymaker. So I'd say it's a balance between jurisdictional regulation and, the hospital's preferences or mission. Sarah, would you like to chime in about the pathway to becoming a SANE?
I will. And also I have some resources because we do have some opportunities coming up. I'll talk about in DC and then some variations, but in DC, DCFNE is the only adult forensic program in the district. Children's National does the pediatric portion of the forensic program. So for us, we require that a person is a registered nurse and also has taken a 40-hour IAFN, which is the International Association of Forensic Nursing, approved for this 40-hour SANE course. And we actually now host these annually. We host, our next one is coming up end of April into May. So we facilitate the sessions. We invite in community partners to teach about advocacy. We have a detective come in and talk about that aspect of it. Well, since COVID, we've been doing it online, and it's actually been, we still try to manage to be engaging and have discussion, and it's not, I don't know, I think it's a little bit more interesting than your typical online program. So in addition to that, we don't offer, DC Health provides funding for people who have a DC license. So I'm gonna give you guys a link and a flyer for an application you can fill out to try and get one of those scholarships. And it covers all the costs of the course, which can be kind of pricey sometimes, and also provides other opportunities for skills training and other programs after the initial 40-hour course. So it helps. So if we're hiring, great. If not, it helps to build your clinical skills. For example, I think Melissa took a 3-month preceptorship with us. So she was like very highly trained when she came and started working with us. She had taken the 40-hour course. She had taken this 3-month preceptorship, and I think did some like skills trainings too. Did you do like photography? I can't remember.
Yeah, I went to the hands-on photography course, and I went to one about like swabs.
Yeah. So she built her skills and made her like a really great candidate, because she could come in and while we still obviously train her, she was a great person to train, because she was like a lot of background knowledge. So we do offer these opportunities of the 40-hour course. We offer like later this year, we have skills training days. Occasionally we have like photography courses and things like that, intermittently. So basically, once a person takes, at least the 40-hour course, they can apply if DCFNE has openings. And basically you can just kind of, if you follow like our social, I'm not trying to like sell social media or anything, but usually that's where you'll see that we're, hiring. And we just have like a pretty simple application process for that. Once we, hire people, we provide continuing education. We attend conferences. We, we encourage people to participate in other aspects outside of like the clinical aspect of it. So if somebody's interested in nursing education, maybe they can help teach a SANE course, or if somebody's interested in facilitating a skills training, like we really encourage nurses to participate in these outside activities outside of just the exam room. So there's lots of opportunities to grow within the organization as well, in my personal opinion.
I'll add that we also support folks becoming SANE certified. And so in order to become a working SANE, you simply have to be SANE trained. There's only a few states that require a certification in order to do the work. And the certification for SANE is similar to other nursing certification that you might have seen, where you work in that specialty for a certain amount of time. And then you take a test to prove that you are, the most competent in that field. So Janessa and Iris are certified. Roxana is going to test to be certified this year. So Sarah and I, of course, are also certified. So we really, try and support staff once they have the recommended amount of hours under their belt to get that additional certification. I'm going to pause and see if there's any questions from the group. Can be questions about anything. It doesn't have to be about things that we've discussed thus far. While people might be wanting to type questions into the chat, so we'll allow time for that. Would anyone on staff like to talk about either what is your favorite part of being a forensic nurse, or what did you find the most challenging when you either started in this role or something that you continue to, have it as your greatest challenge?
I can share, Erin. One of the things that I noticed with the forensic nursing role is it's very different than a lot of things you might find in either the ER or roles where you have to see a lot of patients really quickly. I was previously working in the ER before coming on as a forensic nurse, and I had maybe 5 patients at a time, and you're having multiple different emergencies, and you don't feel like you can really devote yourself to one person. And I always was feeling like I could do more, and I was wanting to be the best nurse that I could, but there was just so many responsibilities. And I love that with forensic nursing, you have that one-on-one approach where you can actually, give your undivided attention to a survivor, and you're meeting them on what might be the worst day of their life. And you can offer compassion in that moment, and you're allowed to, help them to feel heard and to feel safe and affirm them. And we also, have a lot of different education that allows us to be trauma informed and allow patients to become empowered to help them, on that path towards resilience. So it's so rewarding being able to do that for patients. And it's something that's unlike a lot of different areas that I've had experience with. And that's really been my favorite part as a forensic nurse, and something that's kept me here so long. So I think all of our nurses would agree that that's, a big part of it. Even though there is a lot of challenge with you're constantly, hearing stories of horrible trauma. So, you have to be able to have that ability for self-care and the ability to, find the part that is rewarding in the job in order to kind of continue. But that's what I just wanted to share.
I can also piggyback. I definitely agree with everything Janessa has said. That's definitely one of the reasons why I continue working as a forensic nurse. The autonomy is the other part that I think I find very rewarding, because though we are definitely working, with our providers and collaborating in the ED, they're very clear standing orders for us to work independently and to really drive the care for the patient, with the patient, I guess, based on choice. So I think that that's the other thing that I find very different about the program, and also very rewarding. And then definitely being able to meet the patient where they are, and just being there when they have in the form that they need you to be, is, I think, another thing that's really rewarding. And even though you're sort of hearing some tough stories sometimes, and sometimes it's difficult to sort of leave that in the hospital or in the suite. For me, I think what makes it the most special is just seeing that sense of appreciation from our patients when, like Vanessa said, Janessa said, they could be having the worst moment in their life, but they truly are grateful for the cultural competent care that you are providing, and the validation, I think, that they feel both from you and from the patient advocate who's there to support them during this difficult moment.
I see a question in the chat, but I'll let any other staff members chime in if anyone wanted to.
I'll chime in. Yeah, I agree. I feel like the patient interaction is kind of what makes it. You're going to have your difficult days. You're going to have your days you don't get a case, but there's always that one patient that's really going to say, thank you for being here for me, and I feel like that really makes a difference. As for you, just listening to them, being their support system as you ask them the questions. Unfortunately, they're in a way they're reliving it because they're telling you what happened, but then sometimes it helps them also come to terms with it to better cope with it, I found. Because I just seen so much sense of relief, and they're like, wow, like you're just listening to me. That definitely makes it worth it. I would say a challenging part can be when you get exams back to back. Because when you're on call, you're the only forensic nurse on call. So if you can be in the middle of a case and your phone can go off for another case waiting for you. So at that point, kind of just knowing that your time is for that patient. And then when you're done, is that when you're going to allocate that time to that patient as well. I think that's something that it's a challenge going to be ongoing. You can't really prevent people from coming in and you getting called, but you kind of work and learn to it as you grow, and how to handle it and how to delegate tasks and kind of see what you can get started early on and kind of go from there. And admin is always available. There'd been cases when I went in to help a coworker out because she got slammed with lots of cases back to back, and I kind of went in to help her out. So there's always support behind you too.
Thank you. So the question,
and before you do that, I'm sorry. I just wanted to let the participants know, the participants know that I put the link for the application and the dates of the training, the upcoming training, so you guys can apply for that. I think it closes on the 17th, so you'd have to do it this weekend. And we'll let you know by the end of January if you received a scholarship. You can also take the training. If you don't get a scholarship, you can just pay for it yourself if you're able to do that. So the link is there.
Thanks for highlighting that. I wanted to circle back to Tierra's question in the chat, which is, how often do you care for male victims working in HIV services? Many of our newly diagnosed patients report being victims of sexual assault. Unfortunately, many choose not to report or undergo an examination. I will just say statistically, we see an overwhelming number of female patients. And it's not uncommon to see a male survivor, but like statistically overwhelming, I'd say like 3% male and 97% female identifying survivors. At this point, we're always trying to do outreach and make sure that folks are aware and feel safe to come and get an exam, but it is overwhelmingly female identifying survivors at this point in time. And I guess that kind of aligns, right? Because we know that sexual assault is, overwhelmingly predominant in females. So our statistics kind of align to that. But I will say that I feel like we don't see enough male or transgender survivors for how we know that, this is occurring in the DC area. So we definitely work to build partnerships with colleagues and other community groups to try and get the word out about our services and have people trust us to provide that care. I'll keep that chat open for any additional questions, but I know we're coming up on our 1 hour mark. So does anyone from our staff, would anyone like to give any words of wisdom to anybody that's considering doing this work, or anybody that might be interested in becoming a SANE? What wisdom would you impart?
I would say still take the training regardless of whether you're not sure if this is something that you want to do, because it will only enhance your skills and the way you interact with patients as a nurse, regardless of what area of nursing you practice in. And so I think it's totally worth it. And then I would also say commit to the clinical opportunities, and or if you are considering it, it's probably better if you do sign up for shadowing sessions, so you're actually able to shadow an exam so that you have a better understanding of, how it is in practice, to sort of form your decision before committing either way.
I'll just piggyback off of Roxana. We have a number of folks who will take the training and then they will decide that this work is not for them and it's not for everybody. And we understand that, and that is okay. But we do kind of believe in the philosophy that having forensically minded nurses working in all aspects of patient care is only going to benefit the care of survivors in the district. So even if, at this point we've trained 75 people, we've, given a free SANE training to through our grant with the DC Health Department. We don't have 75 positions to hire. I wish we did, but we don't have 75 SANE positions within our program. And some of those folks have gone to work in Maryland or in Northern Virginia, and some have been, hired into us like Melissa and Roxana. But, others have decided that they don't prefer to do this work, but they have taken what they learned and brought it back to create strong partnerships between their organizations and ours to make sure that any survivor that comes into their agency gets the best resources and gets connected with the SANE program. So I second Roxana wholeheartedly that even if you don't end up becoming a SANE, that the class is valuable. And you get 40 continuing education credits that go towards your nursing license. So that's valuable as well. And I've got a crazy cat in the background, so I'm going to let someone else talk.
I'll say that if this isn't for you, that's okay. Kind of like what Erin and everybody else has said. But I will say that working the Neurotrauma ICU you see the end effects of some of what we do. You see the intimate partner violence, you just don't recognize it as such. You know, you realize, I mean, I remember the one patient that really stuck with me was a patient who had been strangled by their partner, and he ended up in my unit as a quadriplegic. So it'll make you a better nurse. You'll learn to identify the signs. I think at this point, if you haven't dealt with this, you see something, but you can't put your finger on it. I think at the very least, you will be a better nurse. You will at least have those resources when you see that patient, because, you know, the statistics are very high about intimate partner violence and sexual assault. So you have nothing to lose.
Any other
I'll
questions?
just chime in.
Oh.
Oh, I was just gonna say, you might realize you love it and realize that you've been doing it for like 5 years and you can't believe it, because it's really a great job. So, and it's great to know and have the information no matter what you do, like everyone's been saying. But yeah, thanks everyone for coming.
Yeah, and if this is something that you're like truly interested in, like pursuing a career in forensic nursing, you know, our organization is continually growing, and we do regularly hire people. So it's not such an exclusive thing that, you know, you wouldn't be able to get a job. So just keep an eye out for the training opportunities and the job postings, and yeah, give it a try if you think you'd be good at it.
All right, well, thank you, everyone. Oh, Iris, were you going to chime in?
I was just going to say thank you. If we're all saying goodbye, thank you. Thanks for being, you know, just curious about this job.
And joining us in the evening. We really appreciate you guys taking the time. Okay, well, have a good night. You guys can reach us. You have Sarah's email in the chat there. If you have any further questions, we'd love to hear from you and hope to see you in one of our trainings.